Okay, so today we will discuss about a very high yield topic, that is a shock. Before discussing this topic, shock, first we discuss the normal circulation shortly of the heart. So what happened in the right atrium? Blood comes from superior vena cava and inferior vena cava. From the blood from the right atrium, it is moved from to the Tychus valve into the right ventricle. From the right ventricle, it moved from to the pulmonary artery into the lung, right? From lung, it moves into the left atrium through the pulmonary veins. And this blood from the left atrium moved into the left ventricle through the mitral valve. Okay, this left blood from the left ventricle finally into aorta, right? Okay,
Yes.
so this is important. This is important. The blood that is coming toward the right atrium is a venous return, or simply you can say the preload of the right heart. And the blood that comes to the left atrium through the pulmonary vein is the preload of the left heart, right?
Yes.
Okay. Okay, there is a different thing. So different types of the shock. The shocks are divided into the many types, but we broadly classify shock into four types, right? So the four types shock. First is hypovolemic shock. So the main culprit in the hypovolemic shock is decreased intravascular volume, right?
Yes.
So decreased intravascular volume lead to decreased venous return. So veins are the reservoir of the blood. If the intravascular volume is a decrease, right? So the venous return will decrease, right? And if the venous return is decreased, what happens? According to the Frank-Starling mechanism, cardiac output will also be decreased, right? So in the hypovolemic shock, decrease venous return or decrease preload lead to
Decrease cardiac output.
yes. So this is a simple pathophysiology of the hypovolemic shock, right?
Yes.
Okay. One more thing. That is again a high yield stuff. One more thing. One more thing. If a venous return is decreased from right heart, what will be to happen to the venous return of the left heart? It will also decrease,
Decrease.
right? So
Yes.
here is a decreased blood comes from the pulmonary vein. If the decreased blood come in the left atrium, what will the pressure in the left atrium? The left atrial pressure is measured by pulmonary capillary wedge pressure. Pulmonary capillary wedge pressure, PCVP, right?
Yes.
So if the preload of the left heart is decreased due to the hypovolemic shock, what happened to the pulmonary capillary wedge pressure? It will be decreased.
Yes.
What will measure the right atrial pressure? Right atrial pressure is central venous pressure, right? So in this case,
Yes.
central venous pressure is also decreased, right? Because of decreased intravascular volume in the vessel, right? So the main main primary disturbing factor for this hypovolemic shock is pulmonary capillary wedge pressure. Pulmonary capillary wedge pressure, right? Okay. So pulmonary capillary wedge pressure will decrease in the hypovolemic shock, right? Central venous pressure will be decreased in the hypovolemic shock. What happened to the cardiac output in the hypovolemic shock? Decrease, because venous return preload is a decrease. What happened to the systemic vascular resistance, SVR,
Increased.
RTPS?
Increased.
Yes, it is increased because of increased catecholamine release, increased sympathetic activation. So what does do the catecholamine? Catecholamines, what does do? They act on alpha 1. Okay. There is an internet problem from my side. Okay, what about my screen is visible or not? What about my screen? Can anybody hear me?
It's visible now.
Okay, so previously we discussed about catecholamine, right? So the hypovolemic shock, what happened in hypovolemic shock? SVR is increased. SVR, systemic vascular resistance, or TPR, total peripheral resistance, is increased because increased catecholamine, nor epi or epi, right? What does they do? They act on alpha 1 receptors. They act on alpha 1 receptor of the arteriole, and in this way they increase the TPR or systemic vascular resistance, right? I hope it makes some sense. So what are the causes of the hypovolemic shock? So we simply divided the hypovolemic shock causes into the two types, right? So intravascular volume, decrease intravascular volume may be due to blood loss and may be due to fluid loss, right? So fluid loss is burned, diarrhea,
Dehydration.
okay, dehydration, sweating, lot of things. Okay, what about the blood loss? Trauma, right?
Yeah.
Internal bleeding,
Yes.
GIT bleeding, right? Upper lower GIT, these kind of the things may lead to hypovolemic shock. So the high yield stuff related to the shock, ups and downs arrows, right? Okay. Next is the cardiogenic shock. The cardiogenic shock, the pathology in cardiogenic shock is basically the infarct of the ventricle, mainly the left ventricle, right? So if infarct of the left ventricle, so what happened when the infarct of the left ventricle? It means heart, the left ventricle contractility will be decreased contractility, right? Okay. When the contractility is decreased, what happens? The blood is pooling backward into the left atrium, right? So the left atrial pressure will be increased, and this increased left atrial pressure is measured by increased pulmonary capillary wedge pressure, right? So this is again a high yield stuff. So the increased pulmonary capillary wedge pressure, increase in mainly in the cardiogenic shock. Okay. The cardiogenic shock mean infarct of left ventricle, right? So infarct of the left ventricle takes place. When the infarct of the left ventricle takes place, the blood is pooling back in the left atrium, and there will be increased pressure in the left atrium. This left atrial pressure is increased left atrial pressure is measured by increased pulmonary capillary wedge pressure. So this is a high yield. So the pulmonary capillary wedge pressure only increase in the cardiogenic shock. If you found a question on the shock, and the only thing that differentiate it will be the cardiogenic shock or non-cardiogenic shock is the pulmonary capillary wedge pressure, right? Okay. So infarct of the left ventricle lead to decreased contractility. So decreased contractility mean what happened to the cardiac output? It will also decrease. So cardiac output will also decrease. What happened to the systemic vascular resistance? Systemic vascular resistance increase or decrease?
Increased.
Increase. Again due to the epinephrine and norepinephrine. Same mechanism as we already discussed about this. Okay. So pulmonary capillary wedge pressure will be increased. What happened to the cardiac output? Will be decreased. What happened to the systemic vascular resistance? It will be increased. And what happened to the CVP? Central venous pressure. Central venous pressure is basically the measurement of the right atrial pressure. It will increase or decrease?
Increase.
Yes, it is increase. Again, the infarct of the ventricle, the pooling of the blood in the right atria as well. So increased right atrial pressure, it will lead to the increased central venous pressure, right?
Yes.
So what are the causes of the cardiogenic shock? What are the causes of the cardiogenic shock? The cardiogenic shock, the most important is MI. Dilated cardiomyopathy. This is again a very high yield. Dilated cardiomyopathy. Why it is a high yield? Because of myocarditis. Myocarditis lead to dilated cardiopathy. What is the most common cause of the myocarditis? It is a viral. And which virus? Again a high yield. Myocarditis. Coxsackie B virus. Right? Okay. So myocarditis lead to the dilated cardiomyopathy, and this dilated cardiomyopathy is one of the cause of the cardiogenic shock. It may be the valvular pathologies, it may be the heart failure, lot of it may be due to the certain arrhythmias as well. But again, a high yield is dilated cardiomyopathy. Dilated cardiomyopathy. Okay. So okay. So what happened is then, sorry, we already discussed about the hypovolemic shock. We already discussed about the cardiogenic shock. Next is the obstructive shock. So obstructive shock, what is the meaning of the obstructive shock? It may be the obstruction at this level, pulmonary artery due to pulmonary embolism. And it may be due to the obstruction because of tension pneumothorax. The pressure in the chest is increased, right? In mediastinum. It will compress the superior vena cava. It will compress the superior vena cava. As well as these pulmonary vessels. So it will obstruct the cardiopulmonary blood flow, right? And another type of the obstructive shock is cardiac tamponade. Obstructive shock. Okay. It may be due to the pulmonary embolism Maybe due to tension pneumothorax. And maybe due to cardiac tamponade. Okay, the thing in obstructive shock, there is obstruction to the cardiopulmonary blood flow. Cardiopulmonary blood flow. Okay. So whenever there is obstruction, what happened to the cardiac output? It will increase or decrease. There is obstruction. It will increase or decrease.
Decreased.
Decrease cardiac output. The first thing. Okay. If there is obstruction, what happened? What happened to the central venous pressure? CVP.
It will increase. Decreased.
Okay. So it is increased, right?
Yes. Yes.
And what happened to the pulmonary capillary wedge pressure?
Decreased. Decreased.
Sorry?
It should be decreased.
Okay. If it is due to the cardiac tamponade, if it is due to the cardiac tamponade, then the pulmonary capillary wedge pressure will be increased. And if it is due to the pulmonary embolism and tension pneumothorax, then it will be
decreased.
So this is a confusing thing. Like if the pathology is due to the pulmonary embolism and tension pneumothorax, then the pulmonary capillary wedge pressure will be decreased. And if the pathology obstructive shock is due to cardiac tamponade, then the pulmonary capillary wedge pressure will be increased. And again, the same is universal. What happened to the systemic vascular resistance, or TPR? In obstructive shock, because the cardiac output is decreased, the body is compensating, increasing blood pressure through the increasing the TPR, right? So TPR increased by catecholamine through the alpha-1 receptor, right?
Yes.
Okay. The last one type of the shock is distributive shock, right? Okay, there are many classes of the distributive shock. Okay, what is a primary culprit of the distributive shock?
Sepsis infection. Sepsis.
Okay, sepsis is the one of the cause. Another?
You can have anaphylactic.
Anaphylactic is which hypersensitivity reaction? Type 1.
Type 1.
The mechanism of anaphylactic reaction is again a very high yield. And CNS injury, right?
Yes.
Okay. The sepsis. So what happened in the sepsis? Sepsis do increase inflammatory cytokines. So the increased inflammatory cytokines lead to vasodilation. So vasodilation lead to decreased SVR or TPR. Right? Decreased systemic vascular resistance or decreased total peripheral resistance because of vasodilation. This vasodilation due to the inflammatory cytokines, due to the infection. Right? Cytokine mediated vasodilation. Right? The mechanism. And what happened in the anaphylaxis? It is again vasodilation due to which chemical?
Histamine.
Right? So you have to learn the whole mechanism of the type 1 hypersensitive reaction. It is a type 1 IgE mediated hypersensitivity reaction. When the degranulation of the mast cell takes place, it will release histamine. And this histamine lead to vasodilation. And this vasodilation lead to decrease SVR or decrease TPR. Right?
Right.
Okay. So what happened in the CNS injury? The CNS injury, the damage to the sympathetic activity. What happened to when the sympathetic activity is decreased? It will lead to sympathetic activity. Okay. In CNS injury, what happened? Decreased sympathetic activity. So decreased sympathetic activity mean decreased vasoconstriction, right? And decreased contractility and decreased cardiac output. So this decreased vasoconstriction again lead to the decreased SVR or decreased TPR. Decreased vasoconstriction simply means vasodilation, right? If the okay, so distributive shock is divided into the three types: sepsis, anaphylactic, and CNS injury mainly. The main mechanism of this shock is vasodilation, right? And all of the type of the distributive shock, there is a decrease systemic vascular resistance. Okay, the key one of the important stuff, the mainly in the sepsis, the cardiac output is decreased. Remaining all other types of the shock, the cardiac output is decreased. Keep these things in mind, right? In only the sepsis, and sometimes you find the anaphylaxis. But for USMLE point of view, you know that the sepsis lead to the increased cardiac output, right? This is some sort of the exception in the shock. Okay. Again, the same thing. What happened to the pulmonary capillary wedge pressure? Pulmonary capillary wedge pressure in all the type of the distributive shock is decreased. And what happened to the central venous pressure? It is again
decreased.
Why it is decreased? Because of vasodilation. The blood is storing in the veins, right? So this lead to the decreased central venous pressure, decreased pulmonary capillary wedge pressure as well, right?
Okay.
Okay, I'm changing the slide. Just give me 1 minute. The screen is again visible or not?
Not yet.
Okay, so this is the picture from the first aid, USMLE Step 1. So here is the only thing that is left, that is mixed venous O2, that is represented as SVO2, right? The only thing, SVO2 is increase in sepsis. You don't need to find out what is the mechanism of increase SVO2 in the sepsis. So the keep in mind, in all type of the shock, SVO2 is mixed venous O2 saturation is decreased, but it is increased is only which type? Distributive shock.
Shock.
Sorry,
yes.
mainly sepsis, right? Okay, what is the SVO2? Is a mixed venous O2 saturation. So if there is a decreased perfusion take place, so what happened? The tissue there is a compensatory change. Our body try to extract more oxygen from the veins, and that why SVO2 is decreased in shock. Okay, again another high yield principle in the shock, that is all type of shock lead to lactic acidosis, right? Sometimes they give you the confuse, they just want to confuse you, give you the some high yield arrows like pulmonary capillary wedge pressure, cardiac output, and SVR. These three are parameters, ups and down arrows, are high yield. And sometimes they also confusing, try to confuse with you metabolic problem. So you have to remember that in shock, the metabolic problem is lactic acidosis, right?
Okay.
Okay. So let's begin some rapid session of the some sort of the quiz. Okay. So I'm give me a moment. I'm going to change the slide again. Just a moment. Is my screen is again visible or not?
Not yet.
Okay. Okay. So I think the screen is visible. Let's suppose 70-year male. 70-year male. ST segment elevation. An inferior lead. Blood pressure is decreased. Right? What will you expect? Pulmonary. Oh, sorry. What will you expect in SVR? SVR. What will you expect in PC? Pulmonary capillary wedge pressure. And what will you expect about cardiac output? Okay. So what are the answers? What happened? 70-year male comes in the emergency. Typical MI pain on ECG ST segment elevation. On examination, blood pressure is decreased. Okay. What will you expect? SVR decrease or increase in that patient?
Increase.
It,
First you have to identify which type of shock. It's a which type of shock?
Cardiogenic.
So cardiogenic. So in the all the type of the shock, the SVR is increased, except the distributive shock. Except the distributive shock. Does they give you the history of the fever? No. Does it give you the brain injury? No. Does it give you the any insect bites? So you rule out that this is not a distributive shock. They typically give you the MI history, and you have to identify what happened to the pulmonary capillary wedge pressure. What happened to the pulmonary capillary wedge pressure? It will be
increase.
increased because of cardiogenic shock. Contractility of ventricle going down and left ventricle mainly. So increased left atrial pressure, and increased left atrial pressure means increased pulmonary capillary. What happened to the cardiac output?
Reduce. Decrease.
Decrease. What happened to the pH? One more thing. What happened to the pH?
pH. I see. This is
it will start to go down.
Yes. So these are up and downs arrows are the super high yield. USMLE love to ask the these kinds of up and downs arrows on the shock. Trust me, you found lot of Q-Banks question, lot of the some assessment question, and these are not a simple one. Try to understand, right?
Okay.
Okay. One more thing. Okay. Okay. So a 25-year male, right? History of insect bite. Present with emergency, right? With shortness of breath. There are typical rashes on the skin on examination. "25-year male, insect bite comes in emergency with a shortness of breath. Typical rashes on the skin. Blood pressure is decreased." So, what will you expect in systemic?
Distributed shock.
Okay,
Yeah,
systemic vascular wait a minute. Systemic vascular resistance, cardiac output, pH. Okay, I'm repeating the thing again for you. A 25-year-old male, 25-year-old male, right? Comes in emergency with a shortness of breath. On examination, blood pressure is decreased. There is a typical rashes on skin rashes, urticaria each rash, and there is a history of the insect bite. Insect bite history, right? So first you have to
Yes.
identify which type of shock is that. Which type of shock?
Distributive.
Distributive. And distributive which type? Sepsis?
Anaphylactic. No, anaphylactic.
Anaphylactic shock. So you have to first think to correctly identify the shock. It is a anaphylactic shock. Okay. So what happened in the anaphylactic shock? SVR is increase or decrease?
Yeah, SVR will decrease.
It will decrease. The only type of the shock in the distributive shock, the systemic vascular resistance or total peripheral resistance is decreased. What happened to the cardiac output?
Increased.
Okay. So mainly the sepsis, the cardiac output is increased, but it may be increased in anaphylactic shock, right? What happened to the pulmonary capillary wedge pressure?
Decrease.
It will decrease also.
And what happened to the pH?
It will decrease.
Yes, right?
Yes.
Okay. So, 30-year male, diagnosed with pneumonia, right? He's a typical symptom of pneumonia. Okay. Comes in emergency with decreased blood pressure on examination and heart rate is increased, right? Blood pressure is decreased, heart rate is increased, typical feature of the pneumonia, 30-year male, right? So what will you expect on pulmonary capillary wedge pressure? Increase or decrease?
Decreased.
Can you repeat the question? You're breaking up.
Okay, I'm saying that 30-year male has a typical sign and symptom of the pneumonia, comes in emergency with decreased blood pressure and increased heart rate, tachycardia. Okay, so on this patient, what you will expect? The pulmonary capillary wedge pressure, cardiac output, SVR and SVO2.
The shock, what
Yes,
kind
so-
of shock is this?
so-
Is it not obstructive shock? What shock is
No.
this? Pneumonia. Is it septic or obstructive?
So it is a
Septic.
infection.
Septic shock.
So it is a septic shock.
Septic shock, okay.
So what are the features of the septic shocks? Up and down arrows. Pulmonary capillary wedge pressure.
Will be decreased.
So pulmonary
No,
capillary wedge pressure
cardiac-
will be decreased.
Decrease.
So what will happen to the cardiac output?
To
Increase.
Increase. What about systemic vascular resistance?
Decrease.
Decrease.
What happened to SVO2?
Increase.
Increase.
Yes, increase. What about pH?
It will decrease.
pH.
pH will decrease.
pH will decrease because all type of the shocks lead to the lactic acidosis,
Acidosis.
right?
Yes.
Okay. A patient due to some trauma, let's suppose 30-year female comes in emergency with multiple injuries on the body, right? And bleeding from the lower limbs, right? Bleeding from the lower limbs due to the multiple injury in the accident, right? What will happen to the pulmonary capillary wedge pressure? What will happen to the cardiac output? What will happen to the systemic vascular resistance? What will happen to the SVO2? First, you have to identify this patient. On
Hypovolemic shock.
examination, blood pressure is decreased, heart rate is increased. Okay. Which type of shock is? Which type of shock is?
Hypovolemic.
Hypovolemic, right? It is a hypovolemic shock. What happened in the hypovolemic shock? Pulmonary capillary wedge pressure will increase or decrease? Decrease.
Decrease.
What happened to the systemic vascular resistance?
Increase.
What happened to the cardiac output?
Decrease.
Decrease.
What happened to SVO2?
Decrease.
Decrease.
Decrease, right? Okay, again a difficult one. This is very difficult. Okay. So let's suppose that 1-year child. This is a child, 1-year child. With a history of viral infection, right? Chest X-ray. Chest X-ray shows cardiomegaly. Blood pressure is decreased. Heart rate is increased. Okay. Ups and downs arrow. Pulmonary capillary wedge pressure increase or decrease. Cardiac output increase or decrease. Systemic vascular resistance increase or decrease.
increase. Pulmonary capillary wedge pressure increase.
Okay. So first you
This is
have to
cardiogenic shock.
identify. First you have to identify it is which type of shock?
Cardiogenic shock.
Cardiogenic shock. Here's history of the infection.
The chest X-ray, you said there is cardiomegaly.
Okay. Was the history of
Myocarditis,
the
heart
viral
failure.
infection as well? Let's suppose he has a fever as well.
Myocarditis. Okay.
Still you say that the pulmonary capillary wedge pressure is increased and the patient is diagnosed from the cardiogenic shock.
Because viral infection may cause myocarditis with chest X-ray.
Exactly. So
Heart
this
failure.
leads to the myocarditis. And this myocarditis lead to dilated
heart failure.
cardiomyopathy. And this dilated cardiomyopathy lead to
cardiogenic shock.
So this is the confusing. Sometimes people on the Q banks, you find that people wrong with this question. In the huge proportion of the people think that this is septic shock, right? But this is a cardiogenic shock.
Can you go over the concept again?
Okay, I'm again repeating that concept for you. Okay, so Coxsackie B virus lead to myocarditis. It will lead to the myocarditis. This myocarditis leads to dilated cardiomyopathy. This lead to the cardiogenic shock. Although as patient suffered from the viral infection and patient may have a fever, but on chest X-ray, he has cardiomegaly due to the dilated cardiomyopathy, right? So that's why the patient has cardiogenic shock and pulmonary capillary wedge pressure will increase, right?
Yes.